Welcome to our annual infection prevention webinar, Go On Pathogen Patrol. This webinar will show you how to arm yourself with the cleaning and disinfecting tips that'll combat facility germs, whatever facility that you are trying to keep clean and disinfected. My name is Kathleen Minisvik. I am the managing editor of CMM Magazine. I cannot do this webinar alone. So along with my panelists, Martha Schmidt, who is our virtual events producer, is helping behind the scenes with the technical aspects. And CMM editor, Elizabeth Christensen, will be popping on later in the hour to help with the Q&A section. Again, this webinar is brought to you by CMM and ISSA, changing the way the world views cleaning and facility solutions. So if you are not a member of ISSA, consider joining. You can go to their website, issa.com, to find out some of the benefits of membership. And now a message from our sponsor, OptiSolve.
When you picture clean, what do you see? With OptiSolve, you can see cleaning insights like never before. Our surface imaging technology detects contamination using a UV light and proprietary BioTracker spray, combined with our specialized software to help prevent health hazards in cleaning validated areas. OptiSolve Pathfinder takes the guesswork out of your process by making the invisible visible with precision cleaning results. Pathfinder surface imaging assessments help improve training and efficiency with easy-to-use tools and interfaces that provide validated evidence. The OptiSolve Savvy digitalized checklists and quality management system gives every stakeholder the confidence only data provides. With robust analytics and simple reports, achieve better results by tracking, standardizing, and setting benchmarks that can be validated in real time with zero guesses. Remove the guesswork and bring your facility into the new era of what it means to be picture clean with OptiSolve. OptiSolve Pathfinder surface imaging system can reveal contamination on physical surfaces when used in conjunction with its proprietary Pathfinder, Halo UV lighting, BioTracker spray, and Savvy image processing software.
Please welcome today's panelists. We have Linda Leibart. She's Executive Director of the Healthcare Surfaces Institute. Dr. Gavin McGregor Skinner. He's a Senior Director of the Global Biorisk Advisory Council, also known as GBAC. And we have David Bradley, who's Custodial Program Supervisor at Penn State University. And I'm going to have each of our panelists just take 1 minute to tell us why infection prevention is so important in the different facilities. We'll start out with Linda, representing healthcare.
Hi, everybody. Well, infection prevention in healthcare is absolutely critical due to the number of healthcare-acquired infections. 1 out of every 17 people that enter a healthcare facility for care will acquire at least 1 infection during their stay that is completely unrelated to why they sought treatment. And this time of the year is flu, cold, everything else sickness. So our emergency departments are visited on an ongoing basis.
We can go with David, representing schools.
Yes, so we have over 40,000 students that are coming from all over the world to a fairly small town here in central Pennsylvania, and it is extremely important for us to let them focus on their education and not have to worry about getting sick or anything like that.
Thank you. And then Gavin.
Yeah, it's a really important question here, Kathleen. Cleaning creates safe and healthy buildings. Right now, as Linda said, reducing the spread of germs. We have seen many people get sick in the last couple of weeks, months over winter. Now, what we want to emphasize is what gets measured gets done. And when you clean, you're cleaning using a quality management system that creates a safe and healthy building, because sick people cost the company money. Sick people close schools. So the idea is that we would like, when people are sick, to stay home. That's called absenteeism. That's not always possible. But what happens when people are sick, they go to work, and that's called presenteeism. And that leads to more people getting sick. And that puts more emphasis on cleaning in a way that decreases the risk of infection spreading and decreases the amount of germs that are in the environment.
Thank you, Gavin. On to our next slide. If you want to take a moment and put in either the Q&A or the chat section, what would you like to learn from today's webinar? And we will try to address your concerns and your questions during the Q&A section at the end. Thank you. Next slide. Okay, we'll start out with kind of an easy, maybe obvious, but maybe not so obvious. Which high traffic facility areas are most prone to germs? We'll start with Linda.
So in a healthcare setting, remember, a lot of the people that are in a healthcare facility are sick themselves, and we shed pathogens all of the time. And so in a healthcare setting, it's really difficult to say which high traffic facility areas are most prone, because all areas of a healthcare facility are very prone to germs. And understanding the way that germs or pathogens move within a healthcare facility, on our clothes, via surfaces, wheels of the food service cart, it's really important that we not just focus on high touch areas in a healthcare setting, but we focus on cleaning all areas. So right now during cold and flu season, one of the things we worry about is people come into the emergency department because they're sick. And oftentimes they may be admitted to the healthcare facility, but the healthcare workers that work with you in the emergency department oftentimes take those pathogens that are there throughout the healthcare facility. So it's really important that you thoroughly clean in between each patient visit. And again, that can be challenging at times because you're up against the clock of room turnover. So a lot of times you got one patient that's done, and many times you'll find they've got like 10 or 15 minutes maximum to turn a room over. I talked to an operating room or a emergency room director of nursing quite a while ago, and she said during cold and flu season, they take a wipe, they wipe the gurney handles off or the railings off, and flip the sheet over and move the next patient in. So they are very challenged at this time of the year to do an effective job of cleaning and disinfection.
All right. And David, what are some excessively germy areas of a school besides all of them?
Yes. So here on at Penn State main campus, we do have over 250 buildings that we are responsible for cleaning and disinfecting, and that ranges everything from classroom buildings to office buildings to daycares to gyms to locker rooms. It really is pretty much everything you can think of. We do have to clean and disinfect here on campus. We focus a lot on entrances. It's very difficult to get into a building without using the entrance, so that is one place that everybody's touching. High touch areas, push plates, door handles, ADA buttons are often overlooked whenever you're coming into a building. Very important for us to focus on all of that. Light switches, restrooms are a really big one for us. There are plenty of things to touch in a restroom. So we have a very specific process that we follow for cleaning every single restroom on campus. Every single custodian knows that process through and through. I make sure of it. And then we have elevators in every single building that are being used and touched constantly throughout the day. So we're focused on those areas as well. And then locker rooms are another really big one where we actually try to focus on disinfecting the entire locker room. We don't go for the high touch points in those areas. We fully want to disinfect those.
All right, thank you. And then we have a lot of other participants in different kind of facilities like office buildings, government buildings. Gavin, is there any high touch areas that our panelists left out or anything you want to add?
Yeah, I agree with what David and Linda said. When I go into a facility, I ask for a floor plan. And often people go, a floor plan? I went, yeah, we don't have one. Yes, you do, because on the wall, there's an evacuation plan, and that's the floor plan I want you to go photocopy so I can start marking out where people are, because people spread diseases. So if you go to a facility and you haven't then got out your red, yellow, and green. You'd use your traffic light system of colors and do a risk assessment on where people move and where they are. And that'll help you actually be more strategic and save you money when it comes to being, like cleaning for health, cleaning to decrease the risk of disease transmission. So always start with the floor plan, map out where those rooms are used and how often they're used throughout the day. Just like David said, those football players, those volleyball players at Penn State that go down the locker room, yeah, they're worth a lot of money. That's big business. Got to protect that. But there's other areas where we can actually save a lot of money and save time when it comes to cleaning and decreasing the risk of transmission. So start with the floor plan, map it out, and then come up with a plan of, am I doing what I'm doing? Is it actually working? Am I decreasing the risk, focusing on air, surfaces, and water where there may be a transmission of infectious disease agents, those germs that we're so worried about?
All right, thank you. We can move on to the next slide. So I think Gavin already started with this, making a plan. Now this is probably a loaded topic, but as we can kind of, each of our panelists kind of give a quick scenario of, some cleaning protocols and tips for staying on top of them. We'll start with David this time.
Yes, so my strategy on campus is because it's so big and we have so many people doing the cleaning, it's to simplify the plan. Everybody follows as closely to the same plan as possible, depending on what they're cleaning or disinfecting. And first off, clean first, disinfect second is, one of the big things that we are trying to teach and trying to keep our people doing. And then we move on to, dwell times, making sure that they understand how to disinfect. And there's so much that goes into it. It's really hard to kind of wrap my head around it right now and put it into words, but there's just so much that they need to remember. So it's just trying to keep it as simple as possible and consistent, doing the same thing over and over.
Thank you. And Linda?
So in a healthcare, and we'll go back to the emergency room because that's where most things come in, is you've not only got high traffic and high contamination, but you've got a lot of movement of people in that area. As David said, a consistency and a plan, and a lot of times at this time of the year, you only have time to hit what are considered high touch surfaces. High touch surfaces would be, the railing on a bed, the med gas units, door handles, light switches, things like that. I saw one hospital actually create, as Gavin talked about, a plan for a situation where we've got high contamination, a lot of sickness has just come in, and they've identified areas on both the walls, on equipment, etc., that should not be missed between each patient. And then at the end of the day, if you really have an end of a day at an emergency room, you do more of a terminal clean where you really disinfect those areas, medical devices, etc. So it's really important. The other thing that I want to say here is when we talk about cleaning in an emergency department, it's not just environmental services professionals that need to be trained to clean. It's also the nursing staff and your lab techs. And there's so many different people that need to take on that responsibility of cleaning in between patients or while they're treating the patient to be able to actually grab a wipe and wipe things off. So it's really important that there be a plan, especially in times like this, and be very repetitive doing the same thing. And the other thing I'm going to say is hand hygiene is absolutely important. I know we've got a slide in the future, but 20 seconds of washing your hands can really reduce the spread of pathogens in healthcare.
Great. Gavin, your take on plans?
Yeah, so in the situation we're going through right now here in the US, Kathleen, with a lot of people absent, a lot of the people present that are sick. And I'm hearing terms like, whoa, continue with your routine cleaning. I don't know what that means. And then someone else will go, oh, we're going to come in and do a deep clean. I don't know what that means. So be a little bit more detail oriented. Focus on the details of how you clean and ensure that the way that you clean reaches the intended outcome that you're focused on. Have a quality management system. Measure cleanliness. And if you don't want to measure cleanliness, go and measure how dirty the place is. Measure dirtiness. You can do that. We have the tools to do that. So it's really important. And just like David said, consistency. I was in a hotel the other day and I was watching people clean different rooms, and it's the same hotel, but they're cleaning them all different. I went, you need to standardize this. If you're going to break the cycle of an infection, if you're going to reduce the risk of the transmission of germs, then you have to follow your protocol, your procedure. And that's that constant continuous improvement, constant training, constant reminders. Guys, this is how we clean the bathroom. This is how we clean the toilet. This is how we clean this area. This is how we do what we do with the bed and the floors. And so be consistent and make it fun. Have a checklist and reward people when they do something correct.
All right, next slide. All right, well, part of your plan is the products and the equipment that you are going to use. If the panelists would please kind of briefly discuss some of the equipment that they found most useful, staying away from, brand names and certain types of active ingredients and cleaners and disinfectants they have found that are helpful. We will start with you this time, Gavin.
Well, I'm going to start off with the worker. I'm going to start off with the personal protective equipment. Cover your holes. Protect your eyes, your nose, your mouth. Understand that germs do survive on your work clothes. So don't go home and just sit down and have dinner with the family or go out to a restaurant in your work clothes. There's germs on them and they can spread. So understand that, it starts with the frontline worker, the cleaning professional, that in controlling that spread. Germs spread on clothes. As Linda said, hand washing. Yep, make everyone sing happy birthday twice. But also look at the products that are out there. The microfiber, that we use. Look at the electrostatic sprayers, which are a delivery system, because time is our biggest enemy. And if you don't know how to use some of these products, reach out to ISSA so we can help you in educating you on how to clean smarter, how to clean based on data, based on science. So again, a lot of the cleaning we do, it requires elbow grease. It's hard work, but there are pieces of equipment and processes that will make our job easier and give you a better return on investment.
Thank you. Linda?
So pathogens are interesting. Not all disinfectants work on all pathogens the same way. We tend to quickly grab a wipe and call it good. It's sort of like with norovirus, we tell people to wash your hands, but the hand sanitizers, the alcohol-based hand sanitizers don't work. So selecting the right products for the right type of microbe that you're trying to kill is part of the challenge. And your infection preventionist actually is the go-to that will help you understand what microbes. When we had, this horrible pandemic, a lot of people chose bleach-based products to actually clean. And in order to kill COVID, it's really actually fairly easy to do. You can clean it with soap and water and kill it. And obviously we won't use those in our healthcare settings, but always reaching for the most damaging type of disinfectant can cause additional problems in the environment. It'll damage surfaces. It can be dangerous to both patients and healthcare workers. So you really want to ask questions about the type of pathogens that you're trying to destroy, and then make sure that you're using those, particularly in an outbreak setting within the healthcare facilities. And the other thing is, Gavin talked about electrostatic sprayers. You also have UV light that can be beneficial in any given setting. It's quick, it's line of sight, so it's not you've got a multimodal solution, so it's not the end all be all. But when you look at potential products that you can use that helps you disinfect, electrostatic cleaners, UV, there's a lot of different options that exist.
All right. And David?
Yeah, so Honestly, what Linda said about, you kind of need to ask yourself some questions. The first thing I always do when I'm looking at a product is, I ask it what I'm trying to do with it, where I'm trying to do it, and how I'm going to apply it. And for us, we're not in the healthcare setting. For most of our general purpose public areas, we kind of go from least aggressive to more aggressive, depending on what we're trying to do. Electrostatic sprayers, I believe I saw a comment pop up about them as well. We do use those for our locker rooms. We actually disinfect football players' pads using electrostatic sprayers. I do think that those work pretty well for what we need them to do. And one tip I think for those is it's sometimes stay away from products with heavy fragrances when you're going into a large area and misting it through the air. But yes, so I think the electrostatic sprayer thing really does work. Understanding what you need to disinfect. In a classroom building, I'm not totally concerned about disinfecting floors, but when I move into a daycare, that is a very important thing because kids spend a lot of time on the floor. They also put everything in their mouths. So I need to be thinking completely differently about a situation like that than I would in a classroom building.
All right, next slide. So we're talking about services and plans, but there's something you really can't see, and that's air quality. That is a big difference. Monitoring air exchange, ventilation. Starting with Linda, are there any specific ventilation practices that you use in healthcare facilities?
Well, this is a really great topic and very complicated, actually, in healthcare settings. Humidity is really important. A lot of viruses, you have to be careful about the humidity in different areas of the facility. And that is not one of my areas of expertise, but it's really critical. One of the things I'll say about air, though, is you need to remember that anything that is in the air is eventually going to land on surfaces. And also, there are surfaces that when you walk, a bed, for instance, a pillow, as soon as you put any pressure on it, it emits into the air. It's on a surface, but it'll move into the air. So air exchanges are really important. I think Gavin has probably a lot more experience than I have in that.
All right, so you did the introduction for Gavin, so we'll have him go next.
Who would have thought that all of us here that are cleaning professionals are now managers of the built environment? We're managers of the health and safety, which means we have to focus on air as well as surfaces, as well as water. And what's been really important, Kathleen, is, here's an example of an indoor air quality monitor that I use routinely. When you start to measure and you look at, like Linda said, the humidity, the carbon dioxide levels, all these measurements that we can take that show us what the indoor air quality is. And then we go, well, how do I change it? Well, there are ways through cleaning you can change them, through maintenance. And so it's really important that we start to calculate the ventilation rates in a room. As David said, it's really important on how many people are in that room and are using that room, and based on what your ventilation rate is and how many air exchanges you can do per hour. And I've been going around to hotels and schools and supermarkets and many other facilities going, you're doing too much. Based on our floor plan, based on our risk assessment, based on our measurements, you've got your HVAC system cranked up so much that you're getting way too much ventilation in here, and you can actually save some money by cranking it down a little bit and then calculate that maybe you need the 6 to 7 air exchanges that you can achieve by having the setting at this level. And that's really important because that's what a manager does. It manages the assets they have to them. So really important that if you haven't had the opportunity to use an indoor air quality monitor, then reach out to us and say, we can set you up with one, and go and measure what the indoor air quality is in some of the facilities you work in or you clean for, and then come up with a plan on how to improve that. And if we don't do that, we won't see improvement. So really important, use the technology that's available and understand that when you use a chemical, it releases volatile organic compounds, VOCs, which can be dangerous, hazardous. Pick the right product and understand it's not just about opening the window anymore. It's about focusing on the science and the calculations and going, now I get it. And that's the way that if you're in this business and you can explain that to your client or your customer, you're going to reach a different level of professionalism. And we want to make sure that we can say all of you are cleaning professionals.
Thank you. So, and David?
Yes, so I am fortunate enough that I have an entire department dedicated to HVAC, and that is not me actually. But I do know since COVID that really sparked a focus on air quality, where I mean, it was always important. We were always looking into it, but it really put it to the forefront of people actually wanting to know what we were doing and what the air quality is. So, believe it or not, since that, we have had quite a few renovations to update our HVAC systems in certain facilities. We are consistently monitoring the indoor air quality in all of our facilities. And like I said, that does fall to a different department that is not me, but it is something that we do take very seriously here.
All right, next slide. This is just a little break for our participants. If this can come up later, but if you want to put in the chat or the Q&A, what are some of the infectious diseases that you are most worried about in your facility and why? And we can get back to that later. It's kind of like a little icebreaker. Next slide, please. All right, so in addition to cleaning products and equipment, technology has also been very instrumental in infection prevention. If the panelists want to kind of say some of the latest technologies that they've used. Linda, I'll start with you because I remember you mentioned UV disinfecting lights. So if you want to mention that or any other products.
So technology, there's a lot coming onto the market, definitely these days. What's important is, number one, you have to do a manual clean before you use any of these technologies. It is absolutely critical that that take place first. So it doesn't replace the manual cleaning that you're going to do. It's just an additional support, let's put it that way. So there's a lot of different things. There's the electrostatic spraying. There are some people that are using ozone. There's a lot of different types of UV disinfecting lights. So a lot of questions that you need to ask your manufacturer. But more important is, what types of products can you use on the surfaces safely? Because if you damage the surfaces during cleaning and disinfection, which is exactly when that happens, you have created microbial reservoirs where they can actually embed themselves in the surface material. And there are technologies out there that actually will damage the surface. There was one new product that came onto the market, which was a wall surface material. And in the manufacturer warnings, it actually says, do not use with UV disinfection. And so you really need to understand what types of technologies and products you can use on the different surfaces and products so you don't cause damage without realizing it.
All right, and next we'll have David talk about some of the technology they use on campus.
Yes, so we are kind of using technology to free up time to allow people to focus on the disinfection. So we have gotten into the robotic floor equipment, which is saving a ton of time from people riding or pushing an auto scrubber around, to actually use that time for projects like disinfecting high-touch areas multiple times throughout the day. We do have some UV technology. We actually did get into a little bit of the ozone technology for athletics. They actually came to us and suggested we try it. But for the most part, we are just using them to give our employees more time to focus on the spray and wipe disinfection.
All right. And Gavin, any words on technology?
We're probably in the most exciting phase of cleaning we've been in for thousands of years. When I was running around the world doing biological weapons in my previous work that I did, I had technology, Kathleen, that came in black boxes that wasn't available to the general public. Guess what? All those black boxes that I used to take to Afghanistan and Iraq are now available to the general public. So UV light technology is so exciting in that we can combine different levels of UV light to make bacteria fluoresce. So we can make the invisible visible. And I love being able to help people showing, well, you can't see it, but it's there. And when you cleaned it, it disappeared. It went, you actually removed it. So you made the environment safer. So UV light is big. ATP meters is, I think, being able to measure the surface based on using an ATP meter is so important. Again, making the invisible visible. But the other thing that I'm really excited about is smart label technology. You might have seen this out there right now, RFID, radio frequency identification system tags on my microfibers. And instead of having to count these manually, 1, 2, 3, I can use an RFID tag on my microfiber, and it's automatically, it enhances my inventory management, my tracking and loss prevention, my performance monitoring, all using the RFID tag with an RFID reader. And we're now seeing these RFID tags even on our containers, our bottles of cleaning products, both cleaning products and disinfectants. And that's really going to just completely change the inventory management system for us and make us more effective and make everything what we do more cost effective.
All right, next slide, please. All right, and as for the opposite of tech, something kind of old school, hand hygiene, how do you encourage your staff and facility and anyone, in the facility, how to keep washing their hands? We'll start with you, David.
Yes, so for us, we are a routine service. We can really only disinfect once, maybe twice a day, and we don't hide that fact, right? We make sure people know that in a building that somebody is going to open a door, 10,000 times, that we're only getting to that once, maybe twice. So we really do push out a lot of education on hand washing and why it's so important. We actually use reusable decals in the flu season that we put out on mirrors in restrooms and things like that. We don't like to keep them there year round because people start to ignore them. But if they go away and then come back, it kind of sparks some attention. So we do rely on those, and we actually, I worked with a psychologist on campus, and we went building to building, and we set up a plan to put out hand sanitizer stations in places that are most likely going to be seen and where they're going to be used. And that is a new addition for us. Personally, in custodial, we never offered that prior to COVID, but that is something that we have taken on since.
All right. And Linda, I imagine there would be pretty strict stipulations about hand washing in medical facilities.
Yes, well, obviously there's a lot. I mean, so there are all kinds of different technologies out there that will actually monitor how many times someone washes their hands. I did a behavioral study years and years ago where I was an advocate for a patient in the patient room, and I actually observed behavior while I was being her advocate. How many times did someone wash their hands? And it was fascinating because they pumped in, there's always a hand sanitizer station right outside of the door or right inside of the patient door to encourage people to wash their hands, either with soap and water or with hand sanitizer. What was interesting is they were faithful in coming in and pumping in and scrubbing their hands. And then they started touching things. They would touch the pen in their pocket that they just used in the other patient room. They would touch a computer screen or a computer keyboard. They would touch the patient hand railing. And so it's very difficult for them oftentimes to continue to wash their hands every time, right? So really the goal is coming into the patient room, washing your hands, and leaving the patient room and washing your hands. The other thing that is really critical is giving the patient the ability to wash their hands as well. The entire time that I was the advocate, that patient, she was non-ambulatory, so she was in a bed, was given one opportunity a day when she got a daily bath to wash her hands. Well, we actually did something about that as we observed that behavior. But it's not only important for the healthcare workers to wash and their visitors to wash and the patient to wash as well throughout the day. Too many opportunities for cross-contamination. It was really an interesting study.
Right. And Gavin.
If we know that 80% of all infections can be, stopped or decreased through proper hand washing, guys, I know 20 seconds is a long time. I know it's hard to sing happy birthday twice. So you turn it into a game, make it a competition. David has just mentioned that probably the first time in the history of Penn State, which is a long, long time, big history, they've started to actually be proactive and be managers of ensuring that the staff and others wash their hands regularly. And I always ask people, why are the handrails of an escalator black? Because we can't clean them and that's where all the germs are and everyone touches them. Well, then just put a hand washing station at the top of the escalator or at the bottom of the escalator so people can hand wash then. But more importantly, it's being able to encourage that behavior change that's required to wash your hands. I know everyone goes and does the 3-second dash. I get it. 20 seconds is too long. But that 20 seconds is based on so much research, so much knowledge that to get rid of the germs, the viruses, the bacteria, you have to use different actions, both the soap, the mechanical action, as well as the water that washes them away. Understand that we're going right through a big norovirus outbreak at the moment, and alcohol-based hand sanitizer has no effect against a norovirus. And I'm seeing people go, oh, use more. No, understand the science. So again, turn it into a game, use the buddy system. Amongst your workers, have people watch each other going, no, yeah, that was a 3-second, go back and do 20 seconds, and encourage proper, appropriate, positive behavior. And because at the moment, Kathleen, what we're seeing right now, again, we've talked about this, there's so many diseases and infections out there right now. In this winter season, so many people are absent or just sick or getting sick again. And a lot of it's just due to improper hand washing with soap and water.
All right, next slide. All right, Gavin, you had mentioned changing behavior. One of the ways to do this is through training. I'll have each of the panelists talk about, what are some of the ways they keep up to date on outbreaks, keep their staff up to date, and what training methods they find most useful.
You want me to start?
Yes, please.
I firmly believe cleaning is based on science. Cleaning is a profession. Cleaning is based on skills. And when people try to tell me that cleaning is unskilled labor, you've just told that to the wrong person. And I will stand up and fight. No, it is based on a skilled workforce. And that means we have to educate and train and continue to train. So I want you to be really understand that adults learn by doing. So as we talk about online virtual simulations, no, every time you change a shift, every time you come to work, spend 10 to 15 minutes focusing on one training topic and understand that our workers learn by doing. The reason that we had listeria outbreaks recently last year in those meat packing plants, the reason that we've had outbreaks of other diseases is because cleaning was inadequate and the staff were improperly trained. And so it's a continuous improvement process of training, managing those skills, learning that, again, what you do today will vary throughout the seasons, the weeks, the months, the years, as we face different risks. Right now, we're facing, flu, respiratory syncytial virus, we're facing COVID, as well as norovirus. 4 different viruses, right? So we've got a quademic, whatever you call it, 4 times outbreak of something. And as we go into summer, it's going to be something different. So focus on it, getting into a continuous improvement program where we constantly train by doing. We learn by doing.
All right, thank you. And David, can you speak to some of the training programs at Penn State?
Yes, so I actually am responsible for all of the training that custodial goes through here at Penn State. There's over 420 custodians, and I'm responsible for training all of them. I will start with staying up to date on outbreaks. How we do it here is we rely on people like Linda, people in healthcare. People who get sick go to them first. They're always the first ones to know what's going on. So we are fortunate enough to have a hospital right off of campus. And we do have contacts where we stay up to date on what is happening. Another way to keep up to date that I found is working with the distributors that actually sell disinfectants. They are usually in the loop of what's going around as well. But in terms of training, it is something I take very seriously. Every single custodian that starts working at Penn State, they spend 40 hours of their first week with just me, 5 days, to learn all of our cleaning processes on campus. I do find getting people right at the beginning of their career is a really good time to hit them with a lot of information. They're usually open to it. They want to do a good job. They want to do things correctly. So that is really whenever I take full advantage and give them as much information as I possibly can. I do, as I mentioned a few times, I like to keep things simple. I don't like to make drastic changes if I don't have to, because people typically aren't open to change, and they don't like it as much. They will try to fight it if they can. So I do think in person is the best way, hands-on, show them how to do it. But I think it's important to be redundant then, and some of that can be online. I put out newsletters every month with tips and stuff on cleaning. I do a lot of video trainings, and it's just all about being redundant. I don't like surprises. I like to know exactly what everyone's doing, what they're doing it with, and how they're doing it. And the only way to do that is to just really keep putting it out there, same message over and over and over, so they definitely will not forget it.
All right. And Linda, your take on training.
So training is so incredibly important. And in healthcare, there are some challenges with that. People don't understand how cleaning is teamwork, right? It is the nursing staff. It's the certified nursing assistants. It's your lab techs. Your infection preventionists is really driving, based on the illness, what types of cleaning and disinfection. In a healthcare setting, there's also challenges between who's responsible for cleaning the medical device, who's responsible for cleaning the patient bed or the patient room, etc., operating rooms, emergency departments. And so for a healthcare facility, a lot of their training is linked to their job performance. They do cross training, and they look for people to support them in their training protocols and processes. But here's the other kicker. When I was doing that behavior study, one of the things I did is I went in and considered visitors of a patient. And it was fascinating. I eventually broke them apart, family and visitors. Your family members for a patient will go in and grab whatever they can, and they will clean the patient area. They will clean the over bed tables. They will clean the handrails. And so really it's about also training the patient family and what's proper use. What do we use to clean? And there are some hospitals that have actually started doing training for the patient's family and for the patient as well, because they became an important team member, especially if the patient's there for a long time. There was a children's hospital that did a fabulous job of this and working with the family and gave them specific areas to be responsible for when cleaning, and they were all over it. So engaging everybody in the training process for keeping the patient safe is important.
All right, next slide. All right, I think this is our last slide before we go to Q&A. So I'll ask the panelists to be brief, but basically just if you can kind of talk about the biggest mistakes you see and how you try and stop them in cleaning and disinfecting. I'll start off with Linda.
So we could do an entire webinar on just this one topic for healthcare, I'll tell you. So every single piece of equipment, every surface has an instructions for use. And it basically says, clean my product using this type of disinfectant in this way. Well, unfortunately, a lot of times those IFUs are in conflict with infection prevention protocols. And so what's happening is the infection prevention protocols take precedent, right? Because they're established for the facility. And so we've got environmental service professionals that are going in and they're following those infection prevention protocols and they're damaging equipment unknowingly. And so this is really a challenge in healthcare right now. It's virtually impossible to follow all of the infection prevention guidelines that conflict with the manufacturer's recommendation guidelines for cleaning and disinfection. An example is there's one infection preventionist told me about the required disinfectant to use for a warmer for a heart patient in operating room. The manufacturer guidelines were used to use Pine Sol. Well, in a healthcare setting, you do not use Pine Sol as a disinfectant for an operating room. And so what happens is there's this struggle. Well, you didn't follow the infection prevention guidelines, or the manufacturer says, well, you damaged the equipment because you didn't use Pine Sol. So we're battling a lot of misunderstandings and misconceptions just in that relationship alone.
Right, and David, what mistakes do you see?
I think the biggest one for us is dwell times. If we really do push efficiency, right, we want them to be able to complete every task that they need to complete, but we also need to make sure that they are disinfecting properly. I think they watch maybe too many commercials and they see the kills 99.9% of germs on contact, and they typically will just kind of spray it down, wipe it up, and move on to the next thing. And we really just focus on training, making sure we do demonstrations, keeping the surface wet with disinfectant for the allotted dwell time, and then also choosing products with shorter dwell times is another way that we can combat it.
All right, and Gavin, you'll wrap us up on this topic.
I think it's important that everyone be able to tell their cleaning story of why they do what they do and understand the science of cleaning and understand that there is chemistry, there are tools, there are equipment. When you put them all together, you have a system, and understand that how you use those tools, equipment, and chemicals actually then decreases the risk of infection spread. And it's so important because what I often see, Kathleen, is people going, well, we're continuing with our routine cleaning. What was that? And they can't tell me what routine cleaning was. Or, there's a school just got closed last week and someone's going to come in and do deep cleaning. I went, what are you doing? And they can't explain to me what deep cleaning is. So let's be more professional. Let's go back to the science of clean. Let's focus on cleaning for a purpose and actually say, we are going in because this is a norovirus outbreak. And if I use this product, it's going to kill the virus. If I do this, it's going to remove contamination. And as we deal with these different infections, these different pathogens, these different germs, you may have to change. And so let's be more professional and actually be able to tell why we do what we do. Go back and measure it. So ensure you've got key performance indicators, measure what you do, and ensure that our clients, our customers understand why we are professional and why we are following the science of clean.
Thank you. Okay, last slide, I believe. All right, I'm going to have my colleague Elizabeth pop on and she can lead the panelists in our questions. And if you guys if you want to kind of maybe we can have one person answer each question instead of having all three just for kind of time considerations. Thank you.
Right, great discussion, everyone, and we have a ton of questions to get through here. I think this first one might be best directed to David. What are some extra steps my custodial department can take to help prevent surges of illness in school districts other than what we do in our daily programming, with our daily program?
Yeah, I mean, I think most importantly, I think Gavin mentioned it earlier, but having like a task list, a checklist to make sure you are hitting everything in your routine, you know, plan it out, look at everything again. There might be something that you're missing, and then add that into a task list and make sure it's getting done. Follow up with inspections. Make sure your products are actually the correct products for, you know, whatever you're trying to fight off, whatever illness it might be.
So this next one, I'm not sure who would want to tackle this, but do you recommend sanitizing spray, then wipe, disinfecting wipes, or electrostatic fogger for high traffic areas?
Yeah, I'll look at that. It's so important, Beth, that we understand that cleaning and disinfecting is a two-step process. If you're spending money on disinfectants, like those EPA registered ones that we look at often when we have disease outbreaks, and you're applying them to a dirty surface, you're just wasting your money. They don't work. And so you have to clean first and then disinfect second. And then that's a two-step process. And that comes through training and education and understanding and being able to show and measure it. So it's really important that I think it's really hard because a lot of our products have information on the label that's really useful. And I'm 57 years old, Beth, and I can't read it. I can't see that stuff. And then they go, oh, go. And then I go to the other, like a safety data sheet, or as Linda said, the manufacturer's instruction sheet, and I don't understand it. So why don't we just make things simpler? And, you know, go and watch David's YouTube videos or whatever he's got. So it's really important that we start to help people clean better for health and safety.
Okay. And here's another question about electrostatic sprayers. They have been approved by the EPA for proper disinfectant use under their regulation, or have electrostatic sprayers been approved by the EPA for proper disinfectant use under their regulations? From what I've read, if not in the specific disinfectant label for use instructions, then you are not able to use it in a manner or with that equipment. Can anybody address that?
Yes, you can use them. And
Okay.
you can, and so I wanted to look at delivery systems overall. And this is a really good question. You have a spray bottle where you can spray stuff. You have a fogger, you have a mister, you have an electrostatic spray. These are all delivery systems. The magic of the electrostatic sprayer, it makes the droplets with it gives them a charge. And so they actually wrap around objects that are irregular shapes. It's a great delivery system. So, you know, here's my standard here. I do a lot of crime scene cleanup. And so crime scene cleanup is really hard and really technical. And we will use electrostatic sprays throughout the whole process because we understand that the product that we put in the sprayer, yes, there can be some chemical changes, but we understand the chemistry, it's still functional, it's still effective. So again, look at all these systems, Beth, like electrostatic sprays as delivery systems. Time's our biggest enemy. And then understand what you put in it has to be a chemical that won't be significantly changed, so it's still effective. And that's where the challenge is that people go, can I put anything in there? No, you can't. You've got to put in there what works. And so it's so important that you understand. And it doesn't take a lot of education learning to do that. But again, great delivery system. It's been around since World War II. Now it's come into the industry and we have big spaces to clean, and that will make you way more efficient than just a hand sprayer or a backpack sprayer.
This next one too is about process. So commercial facilities pre-COVID policy, the cleaning industry instructed never direct spray chemicals on surfaces. You should only wipe. During COVID-19, new instructions were given to spray on desk, tables, dispensers, etc., due to chemical dwell time. It's been noticed chemical damage to surfaces, which I think Linda even mentioned. Now in post-COVID-19, what is the standard for surface disinfecting with the knowledge we currently have now?
I don't know if there is a quote unquote standard. There is research that is currently going on that actually shows that the way that you use, for instance, a microfiber cloth, whether it's wet or dry, actually leads to additional contamination to the surface or removal of contamination. And so we really need to pay attention to what's happening with the research around this, because we are in healthcare anyway. We have seen that if you moisten and remember, there's a lot of different microfiber cloths, there's a lot of disinfectants. I mean, this is one of the reasons why I said I'm not sure that there's a standard, because it really depends upon what you're trying to kill and how you're doing it. But we have research now that actually shows that if you moisten a specific microfiber cloth and then, they test the counter first, pre-cleaning, then they clean it with the microfiber and a moistened cloth, and then they test it again, found more contamination with the wet cloth, and then they went back and then they did it again, spraying a disinfectant and then using a dry cloth, which actually removed the contamination. So I don't know, Gavin, maybe you can answer that question. I'm not sure that there's really a standard way of doing things.
No, this is really important, Linda. Again, cleaning is the removal and proper disposal of contaminants and pollutants and germs. And I see, everyone has a problem and they want to spray it and they want to make it wet. And when you add liquid to dirt, it turns into mud. And there's, we've finished doing studies over the last couple of years. I know you and I have been involved in this on just a good dry clean with certain high quality microfiber cloths, and then measuring the level of contamination after that. And we've shown that we can use less chemicals, but more importantly, know the chemicals you use. And I find so many people can't tell me what they use. They might tell me the color of the liquid, but they can't tell me why they picked that particular cleaning product. So let's start to educate ourselves and start to learn a little bit more about what those chemicals do, and don't just spray them without knowing what you're actually spraying, because they can be hazardous.
What to go with for the last question here? There's so many good questions to come in. So if we didn't get to all your questions today, the panelists will try to address some of them, or feel free to reach out to us too, and we'll get your questions answered. But since this is right on topic, I think I'm going to go with this one. Do traditional broad spectrum disinfectants kill norovirus?
Need to be written on the label. This is where really important. This is where it takes that little bit of education, a little bit of awareness to understand the money you've paid for actually will have the outcome that you're focused on. And so there are, I think EPA has what's called, I think it's list G, is it, Linda? It might be list G, but they have a whole pile of different lists. I think it's list G for norovirus, but it gives you a huge amount of choice when it comes to finding products that are effective against different bacteria and viruses. So you go and look at that EPA list, and then there you pick one off there. So it's not just a random choice here of going, oh, I think I might try this product when I've got a raging norovirus outbreak. I investigated one a few years ago that was being spread for over 30 days because the vacuum cleaner was used to clean up the vomit in the hotel lobby room, and no one thought about cleaning the vacuum cleaner. And then the federal government gone in, the state government gone in, went, they're still getting outbreaks. What's going on? We went in and went, where's the tools and all the equipment you used on that day one, that first day when that person was sick with norovirus in the hotel lobby? Oh, it's this vacuum cleaner here. Has anyone cleaned this? No. And now we're teaching people how to clean the vacuum cleaner. So again, focus on, we've made this easy in the industry by providing lists through the EPA lists. And we've also provided it easy by ensuring that what you use to clean up in an infectious disease outbreak situation has to be cleaned itself before you use it again.
And the
All
other,
right.
let me just quickly add one more comment. There are infection preventionists in public health facilities, in hospitals, oftentimes schools have them. They are a fabulous resource if you're in a hurry to try and get some answers, to reach out to the infection preventionists that wherever they may be, they can give you some additional information.
Right. Good advice. I think in the interest of time, we will end the webinar, but you will be getting an email with the recording, and feel free to go on cmmonline.com and for more information. And you can email me or my colleague Elizabeth if you'd like more information or would like to get a hold of one of the panelists. Thank you so much. We hope you enjoyed the webinar, and I hope you have a good rest of the day. Thank you.